Hello, greetings. Once again, this is Dr. Tina Edwards with Lunch and Rant. Thank you so much for joining me. I hope you've had a chance to listen to some of my other podcasts. Today, I'm specifically going to talk about why are employers paying for health insurance. So if you're an employee of a major company, your company is doing one of two things. Either they're self-insured, and we'll talk about that in a minute, or they're paying for health insurance from some major entity like United Health or Blue Cross Blue Shield, and you're getting a benefit every month. Now, they might be paying anywhere from $1,000 to $2,000 to maybe even $3,000 a month for you and your family to be part of their healthcare plan. And the reason that they get it cheaper, and I hope you can hear the quotes out there, than people who are buying it privately is the idea is that the risk is spread across all of their employees who are going to have varying rates of illness and therefore varying rates of cost. The problem for the employer, however, is that one, they're not competitive unless they offer health insurance. And now, of course, now we have the ACA, which essentially mandates them to if they have a certain size. The problem for you is that they're now paying this money to the insurance company and not to you. And so you want to get value for the money that's not being paid to you. The advantage to having your employer pay for it is really the tax breaks. But let's talk more about what your employers could actually do to really lessen their total healthcare costs. First of all, I really want to talk about self-insurance. So a lot of companies that are large, usually over 100, 500 employees, do something they call self-insuring. This allows them to actually just pay directly for their costs of insuring their employees. Meaning if you break your leg and the bill is $2,500, your employer will actually just pay that $2,500. Now, I realize I'm talking about some kind of fantasy land where the bill is going to be $2,500 because it's probably going to be more like $10,000 or $15,000 because we have crazy pricing. So one of the things insurance companies offer to employers who self-insure is actually being essentially like a mediator between physicians and the companies so that they negotiate with the physicians the price that the employer is actually going to pay. And therefore, essentially, the network that insurer has then becomes part of that employer's network. Well, I'm going to talk to you about a different way to do that. A different way to do that is actually to have a self-insurance plan, and instead of working with an insurance company, actually working with a group of doctors. So this could be a large group like, let's say, for instance, Graybill here in northern San Diego County, or Scripps Health, which is very famous. And so what they do is they actually negotiate directly with, say, Graybill Health, and they say, hey, you're going to take care of my employees, and I'm going to pay you either directly X amount for whatever happens, or I'm going to pay you X amount to do all of these things for my employees. And usually that means something along the lines of any kind of surgeries, any kind of specialist care, x-rays, labs, all of that. This can end up saving employers roughly 15 to 20%. Now, there's some very particular ways to do this, and I'm going to talk more about that on another lunch and rant, but actually ideally the next one. But I just want to point out that insurance brokers are often reluctant to do this because usually their profit comes from selling insurance. They make money, essentially, the more the insurance costs the employer. Now, I'm going to tell you most brokers for companies are actually pretty good, and they are trying to save employers money. And those are the people that I'm talking to right now, along with the employers, is if you're working to save employers money, really consider methods of self-insurance and actually stay away from for-profit insurance companies. And if you have any questions about that, please feel free to email me at drtinaedwards@gmail.com. Please check out my website at wowhealingcare.com, where I'll have more information about that, as well as the benefits of direct primary care to self-insured companies and even companies who have insurance. And please like and share my podcast. I really love talking to you, and thank you for listening. Enjoy your lunch.